not only are you pointing out here are the issues, here's how we're starting to address the change and how we can create this movement together. Because as I've shared with you before, when people pose a problem and we just ruminate about the problem, that's like, I can't take it. I can't take it because
We've heard about it enough, right?
we've heard about it, but also the ramifications on my own, like I get so down and I get so depressed. And I've shared with you privately about like being in my gravest state of mental health and being offered that there wasn't a solution that was actually going to help me, and how much that manifested as a darker hopelessness. And so we don't want to
Hmm.
do that to people. We want to say, here's the awareness, here's our next best steps, right? This is a big problem, but we can tackle it, at the individual level, at the local level, at the regional level, and grow up so that you're seeing incremental change. Because if we point out problems without anyone seeing any movement, then that can be catastrophic. Hello, everyone. Welcome back to the channel, or welcome to the channel if you're new here. We have an amazing change agent in front of us today. We have Dr. Todd Otten. He is a father, a husband, a family medicine physician, a former naval flight surgeon. He is the co-author of Ripple of Change. You're doing so many tremendous things to help bring the healing back into the healthcare system. So I can't wait to share more about who you are. But first, Todd, welcome to the channel.
Oh, thank you so much. That was such a kind and warm introduction. I always feel like I'm blushing. I don't know if it shows up or not, but I appreciate that. Thank you.
Yes, and since this is a human experience and a channel all about getting to know the human, you are more than welcome to blush and share every organic emotion that arises.
Perfect. Perfect.
So for people who haven't yet met you, or just for the people that, of course, we want to get to know a little bit more about you, can you share your story?
Of course. I'm a family physician, and interesting start to that part of my life, if you will. I graduated from medical school in 2002, and I actually did a year of general surgery when I was in the Navy, and I really enjoyed operating. Actually, I loved operating, but the culture, it just wasn't for me. Fortunately, I then trained as a flight surgeon, which is very much a misnomer. It's really primary care for the squadron, the pilots, the air crew, navigators, etc. And I did that for about 3.5 years. And it was during that time where I really started to love the idea of being a family physician. I'd go to get a cup of coffee. It would take like an hour to walk like 50 yards and come back, because everyone would tell me about their rashes and their
Mhm.
ailments, and they needed a refill and all these other things. And I'm like, sick call's like right over there. I'm in the squadron all the time. You just got to walk down and say hi. Anyways, I digress. So I paid back my time to the Navy, and then I did my residency in Detroit at St. John. And then after that, I went to a small critical access rural hospital, and I was there for about 13 years. And for the most part, it was amazing. I got to do a ton of leadership things. I was chief of staff, quality director. I was involved in clinically integrated networks, yada yada yada. ACO, medical director. Actually, for an extended period of time doing that. But during all this, I was also seeing about 6,000 visits a year for several years, which is a tremendous amount for a family physician and probably for anybody really. And in 2019, I really got burned out trying to save the world, do too much. Um, geez, every time I talk about it, I start to like tear up just because it takes me back to those times. I'm actually looking out of my backyard, and I remember sitting out back there one day just crying. The job I loved was becoming a complete chore, and I hated it, and the negative ripples were just ridiculous. Um, but anyways, I fortunately had some time off, about 3 months for sabbatical, if you will, and came back from that, and actually had the opportunity to take over a clinic where the provider was leaving. And I decided I was never going to get burned out again. I vowed that was never going to happen again, and I vowed that we were going to live the quadruple aim. And
I want to stop you because maybe some
yeah.
people haven't heard of the quadruple aim. So can you share with them what is the quadruple aim?
Yeah, so the quadruple aim was an evolution of the triple aim. So the triple aim came out in 2006 from IHI, Institute for Healthcare Improvement. And in its simplicity, it's patient experience, quality care, and lower costs, with population health being an overarching component to that. But in 2014, Dr. Sinsky and Dr. Bodenheimer wrote a pretty important article, in my opinion, suggesting a fourth component being clinician or physician or frankly human well-being. Um, and we evolved it a little bit to what we call our quadruple aim because we feel like it's available for everybody. And if everybody takes ownership of our healthcare system, we can see some tremendous improvement. So to answer the question, the quadruple aim really is patient experience, number one, quality care, number two, lower cost, number three, but then also clinician well-being.
Mhm.
And when you have those four components, things can be magical. um and so in the book, we really focus on our quadruple aim as a lens for when you're making decisions in the healthcare space or even beyond. If you use that framework, it can be magic. And in the book, I was talking about our office with the nurse practitioners. We actually call it the office Utopia.
Mm.
And it was magical.
And before you go too far into the stage of which you're coming back from that 3-month quote unquote sabbatical, which I'd love to hear more about what that actually looked like because I took time off and I can tell you time off isn't time off isn't time off, right? It's really learning how to be intentional. And when we have experienced burnout before, we're higher likely to experience burnout again. And given the person that I know you are, the giver, the person who wants to do the best and serve all and accomplish the best in the service of what people need. I'm curious when you were reflecting back on your experience with burnout, what attributes do you have that you felt contributed and what aspects were systemic that you were facing at the time?
Oh wow. So probably a few things, I guess, from a personal perspective. The capacity to say no was not what it should have been, and I would just take on more and more and more and more. And before I knew it, I had like six leadership roles, and I really never cut back on patient care. And I was supervising two nurse practitioners, and oh by the way, I have four children, and I was president of a soccer club. I mean, I was doing meetings like driving to work. I mean, it
Mm.
was in retrospect, it was ridiculous. I was just trying to do too much. So I think that was the personal component that was the biggest contributor, but the systemic component to it was just a multitude of things. Um, Electronic health records, prior authorizations, feeling like a data collection expert at times, if you will.
Mhm.
I have a T-shirt that says MD equals professional box checker that I had made.
I
And so
yeah.
you factor all that stuff in there, and it's just too
Yep.
much. It's too much.
Mhm. Yeah, it's fascinating. And you, in reading your book, and something I resonated with was your experience as a resident in general surgery. And what stood out to me was you showcased what was going on for you and kind of the evolution of even at that time before you were in family medicine with this big patient load, kind of the signs and symptoms of burnout and frustration there. But then at the end, getting all these accolades and being recognized as someone who is doing great. And I would love for you to share what you shared in your book.
Wow. I Oh wow. That is a wonderful, deep question that I don't think I've ever actually had to answer to this point. And I've probably done 20 to 30 interviews so far. Um, You're right. I During that year, I worked very hard and I did my best. I tried to do my best on a daily basis. And um, it was a struggle. It was a struggle watching my colleagues get yelled at. It was a struggle getting punished, if you will, or getting more work added to my plate for things that I had no responsibility for. You combine that with lack of sleep, not eating. I think I lost 15 pounds. Um, Clearly there were signs of depression. And all this was going on, and at the end of the year, I was the general surgery intern of the year, the emergency room intern of the year, and I hated being in the ER, which is completely ironic. All my
Interesting.
buddies who are ER docs will tell you that. I hated it, but I always tried my best, and then I got, overall intern of the year combined with another colleague, and that wasn't just for, like, 10 or 20 people, that was for 70, I think 70 interns. So, and these are all naval officers. So these are all not only people that got into medical school, but they also got selected for basically a full scholarship in the military. Um, so yeah, you talk about a dichotomy of what was going on. Like internally, I was struggling, but in terms of what I was trying to do for patients, I was perceived as, I guess, a star, if you will. I guess
Mhm.
maybe.
And
That's
I want
crazy.
it's and this is it, right? It's because like oftentimes what I'm seeing, right, it's like this high achievement, and internally we can feel like one, we're struggling, we don't think anything's good enough, but yet from the outside, everything looks like you're doing a spectacular job, but your measurement of good enough is so high that self-deprecating, that self-criticism from the perfectionistic mindset and desire to serve and heal all and save all, right? It combined creates this internal struggle when externally people don't know. And that I've seen it over and over and over again. And it's so interesting because people in when I left surgery, I was diagnosed with high functioning depression, and I'm like, you're functioning until you don't. And when I would leave surgery, I would come home and lay on the floor and not have any personal life because I would sacrifice it all for my professional life. And so if people are feeling that dichotomy, as you said, in their own mind, it's like, I'm struggling, but no one knows it, or we have to mask and act as if we're not struggling because we're afraid to say that we're struggling because of the ramifications to our career. I want them to be seen. And and I saw that in your story, and I was like, oh, what could have been different had people recognized the depths of which you were struggling and provided support and allowed you to see and give yourself permission to reduce those internal expectations for perfection and striving and give yourself permission to rest and recuperate and not take on so much.
Yeah, what's really fascinating about that year is that was the last year before the 80-hour work week.
Hmm.
And so I think part of the issue was the capacity or the time to actually get that rest and recuperation. It just wasn't there. I mean, it wasn't. I literally in the book, I think I calculated my record for being in the hospital for a week, and it was 126 hours in a week. That's just ludicrous, right? I mean, that's 3 times what we the average person does, right? Um, yeah, and I think what really would be interesting about that is if I had the ability or the capacity to rest, recuperate, do the self-care that was required, would I have changed specialties? I think that would be a fascinating question that I don't know that I really know the answer to. Um, as a family physician, I was one of the few people, and I don't know, maybe I was the only family physician in Michigan that was still doing vasectomies. Um, and I did them on a regular basis because I enjoyed the surgery, operating, and doing procedural stuff. Had I had that capacity to deal with that emotional trauma, if you will, when I was an intern, maybe I would have stayed in surgery. I don't know. Maybe we wouldn't be here having this conversation.
That's a thought I've had to consider too, because I left surgery in 2017, and every year since, I just went back to my program to have kind of a peace of mind, a discussion. And it's like, I've been thinking about it. I left without processing it. I signed my resignation, and like a day or two later, I started my other residency, and I never processed. And it actually resulted in a lot worse outcomes for me to not stop and process. So I appreciate having these conversations with somebody who has faced something so similar and contemplated. And, oftentimes we think there's a best fit for us, right? And like, oh, life could have been so different had I been a surgeon. But like, life could be great as a surgeon, life could be great as a family medicine, life could suck as a surgeon, life could suck as a family medicine physician, right? It's like all about what your values are. And when we look back and reflect, it's already biased because we have so much new information now, new skills
Mhm.
now. So who knows, maybe, the work week, but also what could have changed that was positive and negative should you have continued to pursue surgery and been a surgeon?
For sure. Honestly, I wouldn't change any of it. I wouldn't change the highs. I wouldn't change the lows. I think everything that I've experienced in my career has brought me to this point now, which my co-author and I, Joshua, have talked about the fact that we both feel like we're being guided by a higher power to do something much, much bigger than either one of us. To make change on a large scale because it's desperately needed. And I think the good news with that at least is there are many out there who want the same. And I'm seeing it on a regular basis with the conversations that I've had and the people I've met in the last 6 months. I think the key is going to be to get those voices unified and pointing in the right direction to really facilitate changes at the highest level.
Mhm.
That's going to be key. Um,
Yeah, I see you creating. It's interesting how quickly on LinkedIn it feels like we've known each other forever, and the
yeah,
community.
it's so cool.
Yeah, and you're involved in Medicine Forward, and you talk about the network of networks, and what you feel is everyone's coming at different angles, but there's shared thread and mission, right? The values that are aligning, and not only are you pointing out here are the issues, here's how we're starting to address the change and how we can create this movement together. Because as I've shared with you before, when people pose a problem and we just ruminate about the problem, that's like, I can't take it. I can't take it because
We've heard about it enough, right?
we've heard about it, but also the ramifications on my own. Like I get so down and I get so depressed. And I've shared with you privately about like being in my gravest state of mental health and being offered that there wasn't a solution that was actually going to help me, and how much that manifested as a darker hopelessness. And so we don't want to
Hmm.
do that to people. We want to say, here's the awareness, here's our next best steps, right? This is a big problem, but we can tackle it, at the individual level, at the local level, at the regional level, and grow up so that you're seeing incremental change. Because if we point out problems without anyone seeing any movement, then that can be catastrophic.
Oh, this is, you got me really excited now. So this leads into what one of the projects I'm working on now, developing a keynote called "The Power of One Plus One," which is really to inspire and empower, change agents to challenge the status quo. And in a few weeks, I'm going to be going out to a smaller institution in Arizona, and I'm not going to name the institution necessarily, but to deliver this and then have a workshop afterwards to really dig into the four components of our quadruple aim and try and come up with some metrics for that institution so they can see some improvement over time. But the reason you triggered this thought was there is another colleague on LinkedIn who actually does locums at that institution.
Mhm.
Like, what are the odds? That's not how I got connected with this
Mhm.
institution. I got connected with this institution from an old Navy buddy who happens to be chief of staff there now. And in all these other discussions, there's another one of our colleagues who does coaching who goes out there. So now we're going to have her tweaked into the agenda to talk about coaching. I mean, come on, how cool is that?
Beautiful. It's
Yes.
beautiful.
So I'm super excited about it.
Yeah. And so for people who are hearing this and they need to get you at their institution, how can they get a hold of you for that?
Oh, for sure. So probably the best way in that regard is on LinkedIn. I'm pretty active on LinkedIn. If you go to our website, ourquadrupleaim.com, it has all my connections there as well. But Todd R. Otten, just think Todd Rotten, and then you can find me. Sorry. I used to tell that to patients. I said,
Oh, Todd
"How do you
R.
s- how do you say Otten? Just think rotten without the R." And then they would laugh, and it would stick with them. So, anyways.
I love that. That's really funny because you're a change agent who isn't afraid to get dirty and in a professional way. But what I mean by that is I was talking to Kim Downey, who we know and love as a huge physician advocate. And what I was, when you've been in the depths of heck that you've experienced and you have this deep why, it becomes this huge passion. And I think that, when we've reached dark places and mm, we've seen what can happen if you're sacrificing the biggest sacrifice at all, which would be your life, even if it's not literally, but in losing yourself and the things that matter, how much you develop this fierceness to make things change because you feel the pain of it. And that's what I feel coming from you is this fierce in a great way, desire to make change and to push boundaries that are needing to be pushed. When people are afraid to get mental health support, they're afraid to make a little bit of a rattle within their institution because they're afraid to get fired. But if
Mhm.
we see, my message is nothing in your career is more important than your life. And when we have experienced that to the depths of our core, it comes out as this very compelling and attractive, and it's like a magnetic force of I want to be around whatever he's creating. And I'm like, whatever, Todd, when you first messaged me, I'm like, there's something special. Like there's something here that is going to be creating deep changes, much needed changes. And because you're not afraid to do it and you're
Well,
professional about it.
well, most of the time, there were a few f bombs in the book that we had to get sort of curtailed, if you will.
By
But I
curtailed, do you
think
mean removed?
no,
Oh.
I mean, we took out the U and put a star in its place, but
Okay, okay.
they were all quotes.
But
You
you're
know, they're all.
human. It's true actually, there's some data that I hear that people who swear are just honest people.
I That's
I don't know,
interesting.
it's not scientifically proven, but we'll just believe it because I find that when you can just speak in a way, of course, we are mindful when we're in settings with patients and in inappropriate places, but just to be human and let out in a way that allows us to process. Because I think the filtering and sheltering and not showing up whole is what's contributing to a lot of the emotions being stored inside people. Whereas like dropping an F bomb can be like a punching bag, right? So for whatever it is, so for somebody it's dropping an F bomb, for somebody it's screaming, for somebody it's going to the boxing gym and boxing, and how you let it out. Because for me, who has a history of an eating disorder, that to me is when you keep things inside, it manifests as eating disorder, workaholism, substance use disorder, suicidal ideation. Like I find a lot of times if we keep internalizing these things, then it results in really negative consequences on ourselves.
That's fascinating, and I agree 100%. And that's actually one of the things that we really, I would say, excelled at in the office Utopia, if you will, was being honest, allowing for constructive criticism, both ways. To me, to everybody, anybody in the office. Like if something wasn't going well, everybody felt empowered to speak up to try and make it better. And it wasn't that we could change everything necessarily, but at least then it wasn't getting internalized. You know, and I think for the most part that led to a lot of positive results. Not always, but particularly for the nurse practitioners who were learning more and getting more experience with the patient. And I had a pretty complicated patient panel. I probably was more like an internist at the tail end of my time seeing patients. And so to have a nurse practitioner right out of school trying to manage some of this stuff, and I would tell them like, look, if this is above your head, you got to tell me. Let me know when you're uncomfortable, and I will take over or I will try to help answer the questions. And when you have that open, honest, two-way communication,
Mhm.
some of the results are just incredible. And the probably the best part of it was not only was the staff happy and we had a lot, our retention was amazing, but the patients pick up on it too, right? Like they know when things are going well and they want to be there and get care in this particular office setting. It was so much fun. I could go on and on and on about some of the shenanigans that occurred. Like when I came back from vacation and there was a rainbow unicorn above my desk,
Yes.
or or
Uh,
was it the what is it, the may the fourth be with you? I think that's when you celebrate Star Wars or whatever.
yeah.
And one of the nurse practitioners was sitting in my office in my chair with a Wookiee mask on, and I walked in and they scared the crap out of me. It was fun.
I like what you showcase too is getting buy-in and hearing everyone's voice, right? As you said, you can't address everyone's desires and wishes and dreams. But I find that when we have autocratic leadership styles from some people, like I'm in academia, so I'll speak for myself. Um, when you have leadership that takes into consideration other people's voice, where they're willing to solicit feedback and then create actions, then you create the culture where people are like, okay, my voice matters, I buy into this mission, I feel valued, heard, appreciated. When you have an autocratic leader, people get frustrated and they get resistant, and it's like a threat to their safety. And
Mhm.
then if you have somebody in your environment who's not willing to hear feedback, It reduces psychological safety. It creates reduced capacity for people to demonstrate positive creations of solutions because they're afraid to say what the problems are and propose a solution. So then it silos people, and then it reduces the morale of the clinic, and you can palpate that. And if you reduce the morale of the clinic and sense of safety, then patient safety are compromised because communication gets lost because people are afraid to speak up.
Totally. I totally agree with you. It's interestingly enough, in writing the book, the best feedback I got were the hardest questions.
Mm.
And you'd go back and you think you're articulating it one way, but then you hear it from somebody else who you trust or is open about it, and you go back and read it like, "Oh yeah, that paragraph sucked." Like I
Hmm.
need to read some of my best rewrites came up from some pretty harsh criticism. And that's okay. Like if it's truly coming from a place of love and they want it to be the best, you need to accept it as such and say, "Okay, why did they say that and how can I make it better?" And as a physician leader, what frustrated the heck out of me is when I would say stuff like that, not even advocating for me, but for advocating for patients or my fellow providers, and I would just get shut down. That was so frustrating. It drove me nuts.
It's really fascinating. I have, coming up a perfectionist, it's been longer for me to learn to appreciate and lean in and be very grateful that people feel comfortable to give me feedback that's not positive because it
Mhm,
demonstrates to me that I'm a safe place to provide feedback, which isn't natural to me. It took a while to get defensive, as like I said, recovering perfectionist, but now very open and curious. But that open curiosity came from understanding like this isn't a threat. This isn't about you. This is about that writing, about that paragraph, right? It's not a
mhm.
personal attack. And what I've learned is that no matter how you frame some things to some people, they will still receive it as a personal attack. And so I did with my coaching a lot of that humble inquiry and creating conversation through curiosity to try to reduce defenses. But there are some individuals who just aren't going to reduce their defensiveness no matter how much you try. And so that can be very frustrating, especially when you can understand and you've worked on like I've worked on my own reduction in the defensiveness, and this is how I would better communicate to this person to hope that they understand I'm just trying to help. And it's a process, right? It's like I'm still not the best. I still think, oh, I'm such a failure. I suck. I should just quit. I wouldn't even have started. This is a catastrophe. It's epic failure, right? And then you're like, okay, well, you can process through those emotions, and then what do you want to do about it?
Totally. You had me thinking about the upcoming, first go at the keynote and the subsequent, workshop afterwards. And you have those imposter syndrome thoughts come through, like, oh, what if this is a complete disaster? And then I step back and I look at it, or I try to look at it objectively, if you will, and I'm like, you know what, I'm trying to be positive. I'm trying to make a difference. And if not everybody's going to appreciate that, you're not going to win everybody over. And you just have to accept that there's going to be detractors and people who don't like what you say, and just move on and do the best and go from there. Um, I'll tell you a funny story though, in terms of feedback. My medical assistant, and hopefully I'm not derailing this too much. Her name's Carrie. She worked with me for 9 years. And for a medical assistant to be with a primary care doc for that period of time, that's a long time. And we had our ups and downs, like any good relationship I does, or does, I suppose. But early on, I told her, look, we've got to be open. We've got to be able to provide constructive criticism both ways. Like if you don't like something that I'm doing, you need to tell me, and you need to be able to accept it from me as well. And it took a little bit of time, but I think one of the key moments occurred when I was caught up. I like to run somewhat on time, and so she came in to present a case to me, and she's just going on and on. Probably presented it for about 5 minutes, where they live, something about their family, their dogs, the weather. I don't remember all this other stuff. And so she goes on for about 5 minutes, and finally I go, okay, is that it? Yep. And I said, so you're telling me they have a cold? And she's like, she put her head down and goes, yes, they have a cold. And so we at that point we made a decision, like, okay, Carrie, here's the time frame we have to present the case, especially when we're busy. But had we not had that capacity to go have that little bit of back and forth, and for me to give her a little bit of teasing, if you will, she wouldn't have learned. how I wanted things presented in the office. And so we look back on that and laugh, and 5-minute dissertation for somebody who has a cold, but it is what it is.
I would like to know about their dog more, but ends, right? Yeah, it is fascinating. And I think that concise level of presentation is a learned skill because you have to
Mhm.
trust yourself to know what's important, what's not.
But you know what was most amazing about that is Carrie got so good at anticipating like what my next question was going to be that she would start to utilize that when she was checking patients in.
Mm.
And there was a lot of times when she would come and tell me what was going on, and I already knew like the whole kit and caboodle. It was incredible, and that was teamwork, right? But if that relationship wasn't facilitated and wasn't cultivated over time, it wouldn't have had such a yield. And again, I think that speaks to why I kind of landed on the power of 1+1. And this is just another example of that. One physician, one MA on the same page, treating a boatload of patients, but working as a cohesive unit to really provide what I think was very good care for over a decade.
And so after this office utopia, tell us between that and where you are now, a little bit more about that journey.
Sure. The Office Utopia came to an abrupt end on August 2nd of 2022. Not that I know the exact day or anything, but that was the day I was told my clinic was going to be moved back to where I was going to get burned out.
Hmm.
And I went home and looked at my wife and told her this story, and she started to cry. And I'm like, "That's it. I'm not doing this. I'm drawing a line in the sand, and they crossed it, and I'm done." And so I resigned the next morning, literally via an email. I prayed about it for half a day, and I'm like, "That's it." Um, so I stayed on for 5 months, and then, at the end of 2022, I stepped away from patient care, and really the first half of the year was this incredible editing, writing, um, conversations with many, many people to finish the book. Um, and I'll give my here my it's a video. So
Yay!
there's the
Mine is
cover.
on the Kindle, so I'm glad that you have your physical copy to show everybody.
Oh, yeah, if you saw my office, there's copies like all over it. Looks like they just were thrown
Everyone
around the
needs to
room.
order one because he's got enough copies to go around here.
So yeah, and then and the beauty of that was I Joshua and I got just closer and closer and closer, my co-author, as we went through this. We had this yin and yang approach of having conversations from the patient perspective and from the doctor's perspective and bouncing things back and forth. And so then in May, the book was then published. We self-published. As I mentioned, I didn't want to be censored with my expletives and all that kind of stuff. And so from there, it was like, okay, the book's done. What do I do now? So we started working on promoting it a little bit, but even more importantly was the networking. And LinkedIn became this really magical tool for me that I honestly hadn't used it until I think June of this year. Um, and then I started talking to this person, which led to a conversation with this individual or this clinician or this physician all over the United States and actually now around the world. And so now I spend most of my time doing advocacy type work, which includes podcasts and getting information out there, et cetera. Obviously, promoting the book, working with groups like Medicine Forward. And then there's some other things cooking in the background that aren't quite too public just yet. So I don't want to, create any issues
We'll
there.
follow up. We'll follow up on those. We'll follow up on those.
Yeah, and then now going out to these smaller institutions and trying to create some ripples in that way. So it's kind of been this magical opportunity of deciding where I want to spend my energy versus not.
Mhm.
Um, and you know what, Julian? The beautiful part of this is I have met so many wonderful people out there whose heart is in the same place as mine as is yours, and that fills me up. Like to know that I just get emotional thinking about this. To know that we're not going to leave this, or we hope not to leave our healthcare system in such a state of disarray for the next generation. That's what fills me up.
Yeah. And it's something that, when I hear Kim talking about it from a patient's perspective, she's like, I'm helping physicians so that they can take care of me. Right. And who's going to take care of us when we're older? Who's going to take care of people's children's when they're older? I I feel like a lot of people's missions and their why and how we can make the change in healthcare, how important. I think about Kevin Poe, Kevin MD,
Hmm.
and the impact of his platform. Like, I'm not his patient. I'm sure he's a great physician, right? But the impact of what he does outside of the clinic is saving lives. And so we have to help people to see and understand that what we're doing in medicine looks very different, and everyone's perspective and everyone's approach is deeply meaningful and needed. Because a lot of people are like, well, when people are leaving medicine, well, then they're leaving the gaps. I'm like, but they're not, because when we are advocating for the change in the system, it's creating the capacity to actually focus on those things that we can't focus on if, what you were saying, like, I need to understand what I'm going to say yes to, what I'm going to understand, what I am going to say no to, because we already heard you had the challenges saying no before, which contributed to the burnout. So I want people to open their minds, because a lot of people feel trapped in staying in the clinic, thinking that that's how they need to make their impact. But the level of impact being made by physicians, by physician advocates, by patients, by people trying to say, we need people to take care of people. We need to bring the humans back into the healing. And it looks so many different ways. And I was talking to Kim about, she really wanted to provide an impact at the local level and be part of a system. And
Hmm.
sometimes when we're in a system, it actually, just like a traditional publisher might get rid of those F bombs, it might limit our capacity to lean into the mission that we really are desiring to lean into. So I think you showcasing how many different ways you can make a tremendous impact is so important.
It's interesting you say that because that was a big part of the reason why I decided to step away. Is like, I tried. I was very vocal. If you read some of the emails I sent to like the CEO, and okay, you could make the case they were a little passive aggressive at times, right? But I think, in looking back on that, somebody who had the capacity to take on that constructive criticism and say, "Hey, this guy's been practicing medicine for 20 years. He's got like no patient complaints since he's been here. He's been here for 13 years. I think he had one patient complaint. Like, there might be something to what he's trying to tell us, but instead you get this wall put up." And so the point I'm trying to make is I was like, you know what? I feel like my energy is going to be better spent going outside of this institution to try and make a change because I can't get any traction here. And so it really led to what I'm doing now, which has been amazing because it's a lot of fun. So you don't have to be seeing patients, and I might go back and do some direct primary care next year, maybe just a little bit. But the reality is, we need a cohort of individuals to go out there and be vocal and, not have no fear, but to understand that it's okay to rattle some cages because what's going on in many institutions is just unbelievable, and it has to change.
Yeah, well, I am looking forward to what you are going to create in the year and years ahead. But I'd love to hear, what are you looking forward to in this upcoming year?
A few things. The thing I'm most excited about is this evolution that's going to happen in January with the power of 1+1, and where that'll go. Because I'm already seeing like some other institutions that might be interested in having me come on board, or hospital associations that want to hear from me, or risk management associations. And I think it's important for people to get this broad vision, if you will, of how things can look differently. So that's what I'm most excited about. And I'd like to give maybe just a shout out to my co-author Joshua, because without him, this wouldn't have happened. And I think for him to put the amount of time and effort into this and really bare his soul from a patient side would just made it super powerful, because it's not just some doctor complaining about things. It's well, frankly, it's a lot of people shedding light on the reality of things. So thanks again to Joshua and Megan. And yes, I am ecstatic to be able to go out there and try and create not just ripples, but maybe some waves, maybe some hurricanes here or there. We'll see.
As somebody that lives in Houston, oh, make sure that the hurricanes are directed at something that really needs to be taken down. And
For sure.
waves
Waves of positive change.
of
Positive
positive
change.
change is a hurricane that's going to remove the things that are negative, and then when the sun shines, it's going to replace it with things that are, like you said, utopias, if that's a word. Creation of
I
positive
like it.
things.
I like it.
Oh my gosh. Okay, there's so many great lessons and takeaways. What's the last takeaway that you'd like to provide the audience today?
I use this one a lot, and I think it's important because it took me a good 17 years as a physician to learn it. It is okay to say no. When enough is enough, you need to have the courage to say no. And if that leads to other issues, there is so much support out there. Um, Speaking as a physician, LinkedIn is such a wonderful tool to find others, whether it's coaching, but learn how to say no. Say no.
I agree with that, and I'm really glad you said yes to joining me on this YouTube episode today. So, for everybody, share your comments, your questions, your reflections down below. And one more time, how can they connect with you?
Sure. Our website is ourquadrupleaim.com. And then again, I'm on LinkedIn, I'm on Twitter, I'm on Facebook, Todd R. Otten. So if you remember Todd Rotten, you'll be all set.
Thank you so much, Todd, for being with me today.
It was a pleasure. Thank you, Jillian.